will decrease the effects of warfarin because high serum albumin binds to the warfarin, and it makes there less free warfarin, and it decreases the effect of warfarin.
That is correct. 5 questions down, 10 to go. Is Nita going to be able to accumulate enough points to win our grand prize? Stay tuned, and we'll find out after a commercial break from our sponsors.
Are you in the hospital? Have you had your Lovenox today? Be sure to ask your doctor for it. It may also be called enoxaparin. Lovenox is not just any anticoagulant, it's a low molecular weight heparin, which is an effective anticoagulation agent, and can also be used for prophylactic treatment as an antithrombotic agent following certain types of surgery. This medication is not recommended for patients with active major bleeding, GI bleeding, hemophilia, heparin hypersensitivity, heparin-induced thrombocytopenia associated with an antiplatelet antibody in the presence of enoxaparin, bleeding disorders, idiopathic thrombocytopenic purpura, hypersensitivity to enoxaparin, protein hypersensitivity, neonates, infants, and children. Also, make sure that take note and call your physician as soon as you notice any pain and inflammation at the injection site, peripheral edema, or fever.
And welcome back to Are You Smarter Than a Student Nurse? Nita, Nicole, first round is done. Nicole, your time in the hot seat is done because she's already used your assistance. Nita, pick a new student nurse. Okay, Mark. Nita, time for our next question. Okay, Nita, your next question is, what is another way to prevent hypercoagulability of the blood? Nita, you have an answer for us?
Actually, I think I'm going to copy Mark's answer.
Okay, Mark, are you sure of your answer?
Yes.
Okay, show us your answer.
I said hydration because hypercoagulability can occur if there is not enough amount of fluid in the patient.
That is correct. Well, so far, Nita, you're doing very well using the assistance of your students. Are you ready for your next question?
Yes, I am.
Okay, pick a new category. The categories that are left are tests, patient teaching, or nursing interventions.
I think I'll take tests next.
Okay, tests it is. Okay, Nita, Mark. Great job on that last one. Mark, your time in the hot seat is officially done. Nita, it's time for you to pick a new student nurse to choose from to help you.
I think I'm going to pick Katrina.
Katrina, welcome to the hot seat. The next question is, as a nurse, what lab results would you first look at for a patient on anticoagulant therapy? Nita, you have an answer for us?
Yes, I do. I'm going to lock in my answer.
Okay, Nita, show us your answer.
This one was easy. I picked PTT and INR. PTT stands for prothrombin time, and INR stands for international normalized ratio.
That is correct. Ready for your next question?
Yes.
Okay. How many times a week should INR monitoring be performed when warfarin therapy is initiated in the primary care setting? Okay, Nita, do you have an answer for us?
I think I do. I'm going to say once a week.
I'm sorry, that's incorrect.
I'm going to go ahead and use a save and see what Katrina has to say.
Katrina, show us your answer.
I said 2 to 3 times a week because once therapeutic range is established, frequency can be reduced to once weekly. After the INR is stable for 2 weeks, monitoring can be done monthly.
That is correct. Okay, now you might have used a save, but you didn't get any points on that one because she's the one who answered it and you answered it incorrectly. Ready for your next question?
Yes, I am.
Okay. All right, Nita. Now, before we give you that next question, there is something that needs to happen. You're going to have to pick a new student nurse because, Katrina, your time in the hot seat's done. Nita, who are you going to select? Okay, you ready, Micah?
Yeah.
Okay, the next question is, the D-dimer is an indicator of what? Nita, do you have an answer for us?
You know what? I think I'm actually going to peek at Micah's answer.
Micah, show us your answer.
Okay, so my answer is degradation of a blood clot. So the D-dimer assay measures the amount of D-dimer in the blood. So it's a product of phylorin degradation. It is a fragment present in the blood after a blood clot is degraded by fibrinolysis. It is unique that it is the breakdown product of fibrin mesh that has been stabilized by factor 13.
That is correct. Good job at peeking at her answer. Okay, Nita, it's time to pick a new category. Only 2 left, patient teaching and nursing interventions.
I think I'm going to go ahead and take nursing interventions.
Okay? Now, Nita, you have already used Micah's help. You know the routine. It is time to pick a new student nurse.
Please, right here again, please.
I don't think Christine.
No.
Okay, Christine, you ready?
Yes.
All right, the next question is true or false? When administering heparin, the nurse massages the injection site. Nita, do you have an answer for us?
I do. I'm going to lock in my answer.
Show us your answer.
I picked false because massaging the injection site with heparin is actually going to increase the absorption rate.
That is correct. Well, we are getting close to finding out if Nita's going to win the grand prize. Stay tuned. We will be back after a word from our sponsors.